6 minutes.
Thank you, Minister, for being here. And just, before I get started, if you can be really brief in your answers, because I've got a very short period of time here with you. June 1st, the day after the announcement of a limited exemption to the Controlled Drugs and Substances Act for British Columbia, the Minister of Justice was reported to have said, quote, "There isn't at this stage any larger discussion on decriminalization," end quote. So my question is, why isn't this happening? Because it seems to be conflicting to what you're saying today, that you're open to the other applications that are coming. I guess what I'm wondering is what happens if a community like Dawson City applies? Are you going to support resources so they can actually get an application in, or a small remote First Nation in Saskatchewan where they've got an overdose crisis, for example?
I am willing to really accept all applications, but the kinds of criteria that were in there for BC, like law enforcement training, like increasing the health and social services, we need to see all of those things in order for it to be a successful application.
Minister, in 2020, 73% of the people that died of a toxic overdose died outside of BC, and the stigma of criminalization will continue to cost lives across the country. Why isn't this conversation happening outside of British Columbia? And what are you going to do for those small communities that don't have the resources to do a comprehensive application like British Columbia?
Well, I think you and I have had this conversation before. We need the public safety criteria, as well as ramping up the health and social services before we can actually begin that conversation. We have to know the health and social services are there, and we have to know there won't be any unintended consequences in public safety, like gangs, organized crime, and the things that we have seen if you do not have a very strong implementation plan.
Minister, you had an expert task force on substance use. They were unanimous in saying that criminalizing people who use substances needs to end. Unequivocal. So I'm wondering, are your government policies, on this issue based on evidence or on opinion polls?
It's absolutely on evidence, but it's also on the evidence that we had from the frontline organizations that wanted to make sure health and social services were ramped up. You cannot divert people from the criminal justice system to health and services if they're not there.
Minister,
but
they were
also,
unanimous.
yes.
Your own expert task force is unanimous. The evidence is clear. 27,000 people are dead. You don't need more evidence. You don't, Minister.
We need an implementation plan, and that's what we're going to get. We have to have an implementation plan in order to be able to approve these. And so I am very excited that the conversations I've had with that expert task force, people are excited that that big steel door has been cracked open, but it's going to be cracked open safely. We do not want to have what happened in Colorado.
Incrementalism is what's killing people on substance use and the government's response. People are dying. Look, I'm going to go to May 31st. You said safe supply is the real antidote to the toxic drug crisis. What are you doing to scale up safe supply so that it's available to anyone who's at risk of drug poisoning in this country? And Minister, I asked your colleague, Minister Tassi, the Public Services and Procurement Minister, if she's procuring any safer supply. You know what she told me? She said she's waiting for a request from the Minister of Health or yourself, and she hasn't gotten one. Why?
Gord, I think you know that's not how it works.
That's how she's told me how it works.
No, it's not how it works.
The Minister is on record at the Committee of the Whole saying that it requires a request from yourself or the provinces. So if a provinces requests safer supply, will you provide them with a safer supply?
So at the moment,
and in COVID-19, we know, vaccines save lives. So does safer supply.
I agree with that, but I also agree we have approved diacetylmorphine, the injectable heroin at Health Canada, but the pharma science company is not ramping up to produce it. We need all of these things, but we need doctors to be able to prescribe it because there's lots of it out there. Dilaudid, what Christy Sutherland's doing in the downtown east side on powdered fentanyl.
Minister, you're even saying yourself that you can't access what you need. Why isn't the Public Services and Procurement Minister doing it? Anyways, I'm going to leave that with you because I've got more questions. Last May and June, the expert task force recommended Canada make significant new investments in providing a full spectrum of supports for people who use drugs or substances or who are in recovery. Do you believe the $100 million over 3 years in this year's budget implements that recommendation and reflects the scale of this crisis?
So the $100 million is for the substance use and addiction program. But over the past number of years, we've invested about $800 million in this, and that we know that the SUAP program is being hugely successful and is oversubscribed, and we will get that money out the door, and if we need more money, we'll go get it.
Minister, if you look at the comparable amount of money the government spent per capita on SARS, on COVID-19, and the deaths, it's not even comparable. Minister, on May 31st, you said in a statement, quote, "Together we will end this tragic crisis so that no more families, friends, or communities will lose a loved one to a heartbreaking overdose." Do you believe your government has a credible plan to end the thousands of deaths that we're seeing across this country each year?
I believe that we now, with the Canada Drug Strategy, that we actually are working very hard on the prevention, on the treatment, on the harm reduction, and on the law enforcement, and that we are building towards that plan. But we are doing it in partnership with the provinces and territories and with all the communities to be able to do what they can as well on the ground, and that we respond to their needs. Yes.
I think Canadians need to see the plan. I want to know your plan is to ensure all Canadians dealing with substance use disorders can access publicly funded, evidence-based treatment on demand.
Well, I think, as you know, Mr. Johns, one of the problems we need. Well, it was very interesting in the conversation with the College of Family Physicians that the College of Family Physicians. I did a training program that was only 2 years long. They're now considering having a residency program that would be 3 or 4 years, because they want the capacity across the country to be. They do not believe that the family doctors coming out have comfort with mental illness, with addiction, with pain.
Minister,
and so
like other
we
countries
need to
have.
increase that mental health human resources, including family doctors.
Yeah, well, we need a plan. We need a plan to do that. Like other countries have actually had courage and they've committed resources, like in Portugal, like in the Czech Republic, in Switzerland, in Germany, to go on the list. I could keep going. We don't have a plan. Where is the plan? Anyways, Minister, I also want to know what, some provinces are, reject the importance of harm reduction, and they won't seek exemption to decriminalize, for example. Some communities might within those provinces. How will you ensure equitable treatment of people who use substances across this country?
Well, I think that this is going to be, it's what happens in British Columbia, I believe, will be a very important model for the rest of the country. We hopefully will be able to demonstrate that works. It saves lives and it keeps communities safer.
It's a trial group in BC and a trial group with the rest of the country. Is that what you're doing? Will people die at this pace?
What we are doing is, just as Mike said, we're building supportive housing. We're building all of the elements in partnership with the provinces and territories. But so many of the projects go straight into the municipalities so that we can really save lives with the substance use and addictions program, the mental health promotion innovation funds, that we are really then doing the proof of concept that provinces and territories can pick up and run with when it's shown that they work.